Welcome to the Liver Lounge, your go-to podcast for the latest updates in hepatology, featuring discussions with the world's leading experts.
Hi, thanks everyone for listening to the latest episode of the Liver Foundation podcast. I am Dr. Margaret Ting. I'm from the National University Health System in Singapore. And I have here with me today, I'm really privileged and honored to have Professor Jagpreet Chhatwal. He is the director of the Institute for Technology Assessment at Massachusetts General Hospital and also an associate professor at Harvard Medical School. So welcome, Professor Jagpreet, and thanks a lot for taking time to be here with us today.
Thanks for
So I
having
would
me.
like to kind of first start off. I think we've invited him to discuss. He's had a recent study published in the American Journal of Gastroenterology. It's entitled "The Rising Costs of Alcohol-Associated Liver Disease in the United States." So obviously, this is a really topical kind of issue that is of great concern in these few years. And I would like to start off by asking Professor Jagpreet, what is the current state of alcohol consumption and healthcare expenditure due to alcohol-associated liver disease, both in the United States and globally?
So as you can guess from the title, that the cost is rising means that consumption is also rising. And when consumption is rising, consumption of alcohol is rising. That means we expect some adverse outcomes happening in the long term. And in this case, we're talking about alcohol-associated liver disease. Then, if we take a step back, we had started noticing a steady increase in alcohol-related deaths, liver-related deaths in the United States. A few years back, they were about like 29,000, 30,000 per year, and they continue to rise. And using mathematical models, we can see where the trends are heading. So what we are accounting for is changes in the consumption patterns of alcohol and men, women at different age strata. And that is leading to a rise in the alcohol-related liver disease and alcohol-associated deaths. And a related question was how it's also changing the resource utilization, which would be in terms of the treatments for cirrhosis, management of cirrhosis, need for liver transplant is rising. All of these are expensive interventions. And that was this specific study about the rising trends in the cost of alcohol-associated liver disease.
I think in the study, you discussed not just the alcohol-associated liver disease, but also some of the indirect alcohol-associated costs. Were these factored into your study?
Yes, we did account for direct as well as indirect costs. The indirect cost is if somebody dies early and premature death, that also results in the economic losses from a societal perspective. And there are the ways we can estimate that how much is a productivity loss has happened because of a given death and a premature death from alcohol. So we accounted for those losses also to the economy. Because what's happening is that it's some of these deaths are happening at a much younger age now. Because of high risk increase in the high risk drinking at much younger age and younger population, we could expect to see liver failure happening at much younger age than in the past.
And I mean, I think we touched on this briefly, but maybe you could explain to us a bit about the study design. I think in particular, there's the model for the alcohol policy stimulation model, and how was this used to actually project the alcohol-associated liver disease cost, and why did you choose this model in particular?
So the objective was to simulate what happens starting from alcohol consumption, and when a big majority population they're controlled moderate drinking, and then low, and some of them are in transition to high risk drinking. So we looked into data, national data sets, see what proportion of people transition from low risk drinking to moderate to high risk drinking. And as a result of that high risk drinking, we're expecting some damage in the liver. And we simulated that process from early fibrosis stages all the way to end stage liver disease, development of hepatocellular carcinoma, need for liver transplant. And then obviously the major outcome of interest was the alcohol-associated death, liver-related death from alcohol consumption. And by simulating this process, then we can look at it because it takes a long time for many patients to from the early stages to end stage. And then we simulated that process and look at the outcomes at different time periods over time.
I mean, I think it's a really complicated study and it must have taken a lot of time to carry out because there's so many factors in this, right? Like, as you mentioned, it's a long process for patients to develop advanced fibrosis and cirrhosis, and drinking patterns actually differ a lot. I'm not sure if like the changing drinking patterns were factored into the study. And also, I mean, I think you also mentioned that the model was in the paper. You also mentioned that the model was calibrated or validated against another database, and this kind of showed that the model was valid. So yeah, so congratulations with coming up with a very complicated but valid model. So
Yes,
I just want to kind of briefly touch also on the study results. Maybe you could briefly describe or summarize some of the key results of the study that would be interesting to our listeners.
Yes, sure. So the most relevant finding here is the alcohol related deaths, which are rising over time. We expect actually, it's shocking to see that in the next 19-20 years, we are seeing over 1 million deaths from alcohol-related liver disease by 2040. And in addition to those deaths, we are looking at the consumption, the resource utilization. At today, we estimated that we're spending on an average $30 billion per year on alcohol-related liver disease. That includes a cost for liver transplant, cost for managing hepatocellular carcinoma, end-stage liver disease, and other early stages of complications from liver. And this trend is projected to increase by 2040. We expect this number to be around $60 billion per year. So it's almost the double of that and by what we have now. And over the next 18 years, we are projecting about approximately $880 billion of healthcare spending on alcohol, of which $355 billion will be direct healthcare related costs, and $525 billion in lost labor and economic consumption. That's from the premature deaths and then the lost productivity in the society. It's a big number. It's by any means, it's a really big number to pay attention to.
Yeah, that's a huge number. I think your study is probably the first one to kind of pay attention to some of the costs associated with alcohol-associated liver disease. So that's a good kind of gap in the literature. Can I ask, in your study, I think it was also found that alcohol-associated costs are projected to increase disproportionately in females. I'm sure you studied not just males and females, but also other variables. Were there any other interesting findings in subgroups? And also, why do you think that the cost in females would be rising disproportionately compared to males over the next 20 years or so?
Yes, I'm glad you asked that. So what we are looking at is changing consumption patterns. And we are seeing more high-risk drinking now happening in a younger female population. And because of that, we are projecting that many of these people actually will develop these complications of liver in the future. And the proportion of people who are females who are drinking is rising at a much faster pace than males. So that's why the gap between the male and female consumption is overall it's decreasing, the gap between the cost consequences, which are contributed by male versus female, is also decreasing over time.
And do you think that or was there any evidence in the literature that shows that, COVID-19, because I think it was briefly also mentioned or touched upon in your paper, that COVID-19 kind of accelerated the kind of increasing consumption of alcohol? Do you think that has kind of played a part in this? And did your paper kind of, the modeling, did that account for the increase in consumption from the period of the pandemic?
Yes, yeah, definitely we are seeing some changes in the patterns post-COVID. And one clear, obvious pattern is the increased consumption of alcohol. It started happening during COVID. And emerging data are showing that the increased consumption has sustained even after COVID. So we don't have really long-term data post-COVID, but it's whatever the early data is suggesting the increased consumption. We have not gone back to the pre-COVID levels of alcohol consumption. And when that's happening, we can expect that the trends will be different. With increased consumption, some proportion of people will transition to high-risk drinking. And then many of the laws that came during the COVID, the supply side of alcohol distribution changed during COVID. And in many states, they have been implemented after COVID. So we have more access to alcohol than in the past. That could potentially contribute to increased consumption. The works arrangements have changed for many people. Work from home is the standard now for most people, many people in different industry. So that also has changed how we are living our life. And that, again, we don't have direct evidence, but could be contributing to the increased consumption as people are not driving every day to the work and they're more relaxed in the home setting. Plus the overall mental health crisis that we have seen during the COVID, which was highlighted, and it's continuing after that. That also contributing to alcohol consumption, because many people see this as a coping mechanism, which unfortunately is happening. So all of these factors which are pointing towards increased alcohol consumption are also going to be now leading towards increased incidence of liver-related disease in the next decade, and the associated cost.
So I think your study has a very important message. I think the key message would be that the kind of prevalence and also the associated cost of alcohol-associated liver disease is rising. Maybe I'll just ask, how would you see, what are the kind of future directions for research in this field? Would you see, like, what are the unanswered questions that you would think about?
Yeah, from the policy angle, we have to look at what would work, how we can create more awareness about the harms of alcohol, especially high-risk drinking. That is needed. How we can also address the underlying factors that contribute to high-risk drinking of alcohol in the first place. We also need effective medications for alcohol use disorder, which are people who are at that stage. How do we bring them back into recovery? And we need those from the policies for prevention, policies for treatment, and also and for alcohol-related liver disease, we need effective treatment options.
Great. I'm glad you mentioned policies for prevention. So what do you think are some of the strategies that we can employ, or that we can encourage governments to employ to reduce alcohol consumption or high-risk drinking behavior, especially in that group that is at the highest risk, like the young and the increasingly at higher risk females?
Yeah. So it's a difficult question, because it's policy-wise. It's not like just go. We can just ban the consumption, which is not the policy that anybody is looking for. But I think having a narrative of shifting the narrative that it's alcohol consumption has risk, that people are really, it's in people's head that if they consume more than the recommended levels, it does lead to damage in the body. So that message has to be conveyed in a proper way. And I believe that it's most people, even they theoretically know that it's alcohol is bad for health too much, but it's people don't stick with that. It's the overconsumption, high risk drinking continues to happen. And it's only when people realize the damage has been done, it's too late at that time when they realize that the damage of the high risk drinking. So there is a shift in narrative needs to happen, and some that maybe because of could be creating awareness around that would help. To give you another instances that the policy level is from alcohol in the United States, approximately 140,000 people die every year.
Oh.
That's a big number, and many people are not aware of it. And if we contrast with the opioid overdose deaths from drugs, the numbers are around 100,000 per year. Again, it's a big number. Now, a lot of attention is given on opioids, which it deserves. Definitely, it has to go there, but not as much as attention has been given on the alcohol, like the harms and the deaths from alcohol. So that's where I feel that the policies which create that awareness are important. And then they're also giving more resources to address this high-risk alcohol consumption and alcohol use, the rise in the alcohol use disorder in the United States.
That's I think quite a nice way to sum it up. I think definitely more can be done to address this very important issue of alcohol-associated liver disease and alcohol and high-risk drinking behavior. So I think I would just like to wrap up this kind of discussion and ask if you have anything you want to add about the study for our listeners today.
No, I think that you covered pretty much everything.
Okay, that's great. So thanks a lot, and thank you very much for spending your time with me today to discuss the rising cost of alcohol-associated liver disease in the United States with us on the Liver Foundation podcast. Thank you very much, Professor Jagpreet.
Thank you. Thanks for having me.
We have come to the end of the episode. Thank you for joining us, and stay tuned for more captivating discussions.